Hey everybody, in this video we are going to be going over some of the treatments that you will be receiving during your care in our office here. So you may have noticed that we have some unique equipment in the office. That is something that we are very proud of. It's a very unique technique that we utilize here. It's called chiropractic biophysics, and it is very posture focused and spinal curvature focused. Okay, so everything that we're doing is designed to essentially normalize the structure of your spine. The reason we do that is because when you have an abnormal structure in your spine or an abnormal posture in your spine, it is correlated with higher levels of pain and lower levels of overall function. So obviously these are the kinds of things that we seek to treat and to correct. Every patient's treatment plan will be a little bit different in terms of the exercises that they're doing, the tractions that they're doing are highly individual, so yours will not be the same as somebody else's because again, all of this is tailored to your spine based off of your x-rays and your postural analysis. But generally speaking, we'll be doing the chiropractic adjustment. That will be where we are adjusting your spine manually with the hands, or we also have the instrument, the Impulse IQ, which is a very gentle way of making sure that the spine is moving appropriately, making sure your nervous system is functioning appropriately and helping to kill pain. And we also have the drop table that we can use to adjust the spine as well. Again, a very gentle modality that we can use to ensure that your spine is moving and that we're getting you out of pain. Because the first stage of care is all about making you feel better. We want you to get out of pain, and we want to restore range of motion, and we want to get you back on your feet and feeling good. Phase 2 of your care is where we will start implementing the spinal traction and the exercises. Now, the exercises are designed to improve your posture by strengthening the muscles that have become weak over time because of an abnormal posture, or deconditioning as it's called, and we want to stretch the muscles that are tight, that are, again, holding you in that abnormal posture. So this is a process. Posture is a habit like anything else. Once you've been in an abnormal posture for a certain period of time, that's kind of like your preset. That's where your brain knows your body wants to go, and so it's simply much easier for your nervous system to say, this is our posture now, we're just going to hold it here. So by doing these exercises, these corrective movements over time, what we're working on is not only strengthening the muscles that are weak and stretching the ones that are tight, but also neurologically speaking, we're working on resetting what your brain and your body thinks is normal posture. So that's how we get posture to change over the long term. We have to continually input into the system what is correct posture so that we can build up the strength, the flexibility, and the neural pathways between your brain and your body to really improve that posture long term. Lastly, the thing that makes us very unique and different is the spinal traction. Now, in the spine, when your spine has been in the wrong position or an abnormal position for a prolonged period of time, what happens is the ligaments in the spine adapt. They change shape and size to hold your spine in that abnormal posture because it takes load off of the muscles, it takes load off of the rest of the system, it makes it more energy efficient so that your muscles aren't working overtime to hold you up. However, what this does is it actually changes how your spine moves, it changes how your spine functions under gravity, it increases degenerative forces, it increases the risk of disc herniation, spinal arthritis, slips and falls, and over time, what we're going to do is shift your spine back into a normal position. Now, this is where the x-rays come in. We will look at your spine and we will compare it to our normal spinal model, and that will be the guide for what tractions are appropriate for your spine. Remember, not every patient is going to have the same exact traction setup. It's very individualized for what we see on your x-rays. So once we get those x-rays and we've analyzed them and we see what we need to do, that's when we will go ahead and put you in traction. We'll get you your home care devices, the Dental spinal orthotics, so that you can be doing your traction at home as well. Traction needs to be done consistently. Ligaments are really, really strong, which is a good thing. We want our ligaments to be strong because that provides stability in our spine. But because of that strength, we need to mold them over time to do it in a safe and effective manner that's going to allow the spine to change and heal in the proper position. I want you to think of traction kind of like braces for your teeth. You can't just wear braces for a couple days and get straight teeth, right? So same thing with spinal traction. We have to do it consistently and over a period of time, so that the ligaments have that time to basically change and mold into the new position. And then once you're done with your initial treatment plan, we'll get re-x-rays and we will see where your spine has moved, and that will dictate if we need to continue doing traction. Maybe we need to make a change to your traction setup, or maybe we fit your goals and your spine is where we want it to be now, and you can drop to maintenance care, coming in once every couple weeks. Again, that's all going to be determined on a patient-by-patient basis, but that's just a general overview of what your treatment will look like in our office. If you have any questions at all, please bring them up at your next visit. I'll be happy to answer them. Thanks, guys, and I'll see you on the next one.